This scenario is an example of both unprofessional and disruptive behavior that can take place in any hospital. As a physician leader, it is important for you to be able to anticipate and prevent situations involving disruptive behavior. As well, it's important to have a strategy in place to deal with disruptive behavior when it does occur. The medical administration of St. Elsewhere's Hospital feels extremely fortunate to have attracted Dr. Turbing to their orthopedic staff. He comes to St. Elsewhere's with the reputation of being one of the smartest residents that his training program had ever produced. He's a very meticulous and competent surgeon. He's a hard worker. He's more than happy to work long hours. In fact, he appears to be driven to excel and wants to turn St. Elsewhere's into an internationally recognized center of excellence in orthopedic surgery. As Dr. Turbing arrives, Dr. Whelmed, the medical director, is having a very busy year with a budget shortfall, a new CEO, and a new director of nursing to deal with. In addition, there are conflicts developing with the ER physicians who feel they deserve a better financial package from the hospital. Dr. Whelmed was on vacation when Dr. Turbing and his family arrived in town, and no formal orientation to the hospital had occurred. Within the first 6 months of Dr. Turbing's arrival, Dr. Whelmed hears indirectly of 2 incidents involving Dr. Turbing that had occurred at the hospital. These had not been reported directly to Dr. Whelmed, so he didn't feel he should investigate them. Specifically, it was suggested that on one occasion, Dr. Turbing had behaved in a very threatening manner to one of the hospital's general surgeons. He had bumped one of Dr. Turbing's cases because of an emergency. Reportedly, Dr. Turbing had lost it and ended up in a screaming match with the general surgeon in the OR corridor, insisting that the case had not been a genuine emergency and threatening that it better have not happened again or else. What was particularly upsetting for nursing staff was that the whole incident was witnessed by patients on stretchers awaiting surgery. The head OR nurse thought Dr. Whelmed might like to know about this. In another incident, about 2 months later, the acting director of nursing had been notified that Dr. Turbing had returned to a ward to personally berate a nurse who had called him to clarify a medication order. The dialogue had been, once again, very loud and very public.